Section 8.16, First Aid Procedures. General First Aid Protocols. Universal approach. Assume all victims are COVID-19 positive. For all rescues, minimize the number of rescuers who have contact with the victim. For in-water rescues, avoid face-to-face proximity with the victim and other rescuers. At each focal point, provide a dry container, include hand sanitizer and PPE for 3 rescuers, 1 victim, and 1 bystander. Post-rescue, resuscitation or first aid with bodily fluids, hand hygiene, shower, change clothes, bag clothes to be washed, disinfect first aid equipment. Change into backup uniform kept in individual locker found in Ziploc bag. When to use personal protective equipment for first aid. Again, we will revisit the chart given to us by the Life Saving Society. Green zone should include face shield, surgical mask, gloves, and a victim wearing a surgical mask. Again, these are disposable surgical masks and not the reusable masks given to you by the facility. The yellow low-risk zone includes a lifeguard wearing face shield, surgical mask, gloves, and a protective gown, our yellow disinfectable gowns, and the victim wearing a surgical mask. Once we get to the high-risk red zones, a lifeguard should be in an isolation white Tyvek gown, a face shield, a surgical mask, and gloves, and the victim should be assisted with use of a BVM with a viral filter and continuous seal maintained, or a surgical mask for compression-only CPR or other treatment. And for CPR, mouth-nose must be covered at all times, sealed by a BVM or a pocket mask with that viral filter. Respiratory hygiene measures. Educate all victims to cover their mouth and nose with tissue or elbow when coughing or sneezing. Disposable medical masks are available for lifeguards and public when performing first aid. Victims who require resuscitation should have a mask covering their mouth and nose or a continuous pocket mask or BVM seal for CPR with viral filters in both. Here, you do have a diagram of a bag valve mask if you have not seen one before. We have the bag, there is then the PEEP valve, there is a viral filter right above the mask. We then have oxygen tubing with the tubular connector, and there also on a bag valve mask is a reservoir bag that we will see on the next slide. Use of oxygen. The use of high-flow oxygen is considered high risk as it generates aerosols and therefore should only be reserved for victims requiring resuscitation or CPR, children and infant victims, pulse oximetry of less than 94%, and drowning victims. On this diagram of a bag valve mask, you see the oxygen inlet and tubing, the reservoir bag, as well as air inlet and pressure release valves. First aid for children or minors. When possible, ask parents or caregivers to provide first aid to children or minors if it's something like a Band-Aid. Provide the parent or caregiver with PPE appropriate for the injury. Provide guidance to the parent or caregiver performing first aid. If you are going to be performing first aid on an infant, you will be wearing the yellow disinfectable first aid gown. Adjusted scene assessment. Ensure the scene is safe. Assume universal approach, all victims COVID-19 positive. Minimize number of rescuers in contact with the victim. 2-meter physical distancing at all times if possible. Don appropriate PPE for yourself, the victim, bystander. Obtain a victim history if they have COVID-19 or not. Mechanism of injury, and a continuous and dynamic scene assessment. Adjusted scene assessment guidelines. Maintain physical distancing of 2 meters whenever possible. Collect information about the health status of the victim with regards to COVID-19. It is important to pass this info on to EMS, allowing them to provide optimal treatment to the victim. This information may be obtained from the victim, victim's caregiver, or bystander. Determining the victim's health status and COVID-19 infection can be accomplished by asking common questions. Adjusted primary assessment. Conscious victims should self-examine where possible. Level of consciousness. Call EMS if life-threatening illness is found. Secure airway, check breathing, check circulation, and treat for shock and prepare for transport if appropriate. Adjusted primary assessment guidelines. Maintain physical distancing of 2 meters whenever possible. Determine if the victim's condition requires the lifeguard to make direct contact with the victim. Alternate options may include a victim's caregiver or family member administering first aid with lifeguard direction for minor injuries. Don the PPE required for the level of victim contact and first aid treatment. Both the rescuer and victim should don PPE. Remember, this is mainly those disposable surgical masks. For a lifeguard, you will also be wearing gloves as well as your face shield. When the victim history indicated positive or suspected COVID-19, inform EMS immediately. All of staff and patrons should evacuate the first aid building to decrease chance of spread. That means all staff should exit the first aid room and let EMS come through the back if this were to occur. Proper hand hygiene is important after all first aid treatment. Adjusted secondary assessment. Conscious victims should self-examine where possible. We're going to check vital signs, history, and a head-to-toe exam. Verbal exam for conscious victims. Adjusted secondary assessment guidelines. Maintain physical distancing whenever possible. Only take vital signs that can be observed from a distance. An example, skin color, visual breathing check, or those required for victim treatment decisions, i.e. skin temperature, on a possible heat stroke victim. Post-rescue procedures. Take care to remove and dispose of PPE in a safe manner. Disinfect all surfaces that may have come in contact with the victim or rescuer during treatment, chair, pen, clipboard, etc. Practice hand hygiene and disinfection if required. After each rescue, all rescuers should practice hand hygiene, shower with soap, change their clothes, and beg their clothes worn during the rescue to be washed by the facility. Disinfect all rescue equipment used by using our Oxford cleaner. Guidelines for in-water rescue. Prior to entering the water, the rescuer should remove any face coverings being worn. This includes disposable face masks as well as reusable face masks. Approach the victim in a manner to avoid face-to-face contact. Minimize the number of rescuers who have direct contact with the victim, and where possible, designate a rescuer to take the lead during first aid resuscitation. This allows the in-water rescuers to dry off and don PPE before continuing victim care. After each rescue, all rescuers should practice hand hygiene, shower with soap, change their clothes, and beg their clothes worn during the rescue to be washed by the facility. Disinfect all rescue equipment used. This means, with these guidelines, that we will have one rescuer enter the water if required, hopefully leaving the second lifeguard on deck to put on their PPE, including their white Tyvek suit, their gloves, their disposable surgical mask, and their face shield. They will take over care of the victim when the victim and first rescuer reach the side of the pool. The first rescuer will exit the water, don their Tyvek suit, face shield, gloves, and surgical mask, and those two rescuers can then continue care. Resuscitation CPR guidelines. In-water assessments should not be performed. We will not be checking for breathing until we have the victim to the side of the pool with a rescuer that is wearing all of their major first aid PPE. Pocket masks should not be used without a viral filter at all. Bag valve masks are the preferred ventilation device over pocket masks, even with the viral filter. PPE must be donned prior to resuscitation efforts. The victim's mouth-nose must be covered with a surgical mask, pocket mask, or sealed BVM mask at all times. CPR AED training. The bag valve mask replaces the pocket mask in CPRC training. 2 rescuers, 1 compressor, 1 ventilator, at a minimum, are required for CPR with ventilations. Aquatic staff will continue using the same training protocols provided in the CPRC AED course. Compressions in AED would take priority over application of a BVM. The bag valve mask is a supplementary training item as a response to the COVID-19 pandemic. OPAs must be used when using a bag valve mask. Training in the use of a bag valve mask does not certify staff in CPR HCP or BLS responder. CPRC AED award must remain current or within the certification extensions offered by the Life Saving Society and Red Cross due to the COVID-19 pandemic. We see here a diagram of the bag valve mask once again. The use of a bag valve mask for lifeguards this year follows the same routine as CPRC, just instead of the 2 breaths being administered with a pocket mask, you're going to give 2 breaths using a bag valve mask. Even between breaths, a seal must be held at all times to make sure that the victim's mouth and droplets are covered. Bag valve mask guidelines. The device has 3 main components: bag, one-way valve, and mask. The bag is self-inflating. Once the bag is compressed, it reinflates automatically. So the bag that we are talking about is labeled on both diagrams as self-inflating bag. That is the part that is rubber, and you would squeeze evenly and slowly until the bag has deflated, and then it will reinflate on its own. The one-way valve allows air to move from the bag to the victim, but prevents the victim's exhaled air from entering the bag. An oxygen reservoir should be attached and inflated. This reservoir bag will only inflate when you are hooking up oxygen tubing to the bag valve mask. A HEPA viral filter should be attached and must remain dry to be effective. All of our bag valve masks in our facility, including our 2 adult and 1 child infant mask, include viral filters. 2 rescuer BVM technique is preferred, since 1 rescuer is free to hold 2 hands to hold the mask while the other performs ventilations. This means that 3 lifeguards are ideal when using a bag valve mask while doing CPR. 1 will hold the pocket mask seal, 1 will inflate and deflate the bag as required, and 1 will be doing compressions. If the 1 rescuer BVM technique is used, an OPA must be inserted. Rescuers responding alone or with delayed backup would perform compression-only CPR until the BVM arrives with a surgical mask administered to the victim. A continuous seal must be applied to protect from airborne pathogens. If a continuous BVM seal is not applied, a mask must be covering the victim's mouth or nose. Applying these guidelines. Examples of how first aid guidelines are applied. In a 2 lifeguard rescue. Lifeguard 1 signals and removes face mask to blow whistle, enters water with rescue aid. Lifeguard 2 initiates clearing the water, provides backup, and assists with victim removal. Where backup is not needed in the water, Lifeguard 2 will don their PPE, including their white Tyvek suit, gloves, surgical mask, and face shield. All rescuers involved with victim care must dry off and don appropriate PPE prior to delivering first aid. Provide surgical mask to victim during care if they are conscious. If available, direct other facility staff to assist in complex rescues or to call EMS. Follow disinfection protocols post-rescue. 3 lifeguard rescue. Lifeguard 1 signals and removes face mask to blow whistle, enters water with rescue aid. Lifeguard 2 initiates clearing the water, provides backup and assists with victim removal. Where backup is not needed in the water, Lifeguard 2 will don PPE. Lifeguard 3 remain dry. Don PPE and initiate victim care. Lifeguard 1 and 2 must dry off and don PPE prior to delivering first aid. Provide face mask to victim during care if conscious. If available, direct other facility staff to assist in complex rescues or to call EMS. Follow disinfection protocols post-rescue.